The safety of vaccines and the safety of the American people is of the utmost importance to us.
First at 4, the federal government is taking a step back and evaluating a possible side effect of the Johnson & Johnson vaccine. They're asking health departments to suspend the use of this COVID-19 shot over the news that 6 patients out of nearly 7 million have experienced dangerous blood clots. And Indiana is following that request, and now thousands of Hoosiers are changing their plans. This is our top story here first at 4. Thanks for joining us. I'm Birsha Admay.
And I'm Lindsay Eaton. We have team coverage on this developing news today, how the decisions are being made, and what you can do if your appointment is interrupted.
And we do start first with Darius Johnson in our newsroom. So Darius, what are the next steps in this process?
Well, good afternoon, Lindsay and Birsha. You know, I do want to note that this stems just from 6 cases out of nearly 7 million doses administered, as you just mentioned. The FDA and the CDC are now halting doses so they can continue to investigate and find the root of this problem.
Due to reports of 6 cases of a rare and severe type of blood clot following vaccine administration. We're recommending this pause while we work together to fully understand these events.
That rare type of blood clot, according to the CDC and the FDA, is cerebral venous sinus thrombosis in combination with a low level of platelets in 6 women between the ages of 18 to 48.
Of the clots seen in the United States, 1 case was fatal and 1 patient is in critical condition.
Officials say this combination is different from a typical blood clot and is also treated differently, which is why they are investigating.
Healthcare providers who see people presenting to them with either a low blood platelet count or blood clots should establish whether or not the individual has recently been vaccinated.
Our local health experts say this could increase vaccine hesitancy, but it's part of the process under emergency use.
I think what we're seeing play out in real time is a normal scientific process where, we find a blip of data and we kind of investigate it to see if it's real or not.
The CDC is still encouraging Americans to keep their vaccine appointments if they already have one.
There are 3 vaccines available, and we are not seeing these clotting events with low platelet counts with the other 2 vaccines.
And if you have questions about moving forward,
call their doctor and get some advice, because physicians are monitoring this very closely and they will be able to sort of assess your situation and tell you, yes, go ahead with the vaccine, or maybe wait 1 more week until we know a little bit more about these isolated cases.
Now, tomorrow on Wednesday, the CDC's Advisory Committee on Immunization Practices will review the data of these cases and also consider the next steps. Now, those at the federal level say the timeline of the pause will depend on what they learn, but they do expect it to be a matter of days, not weeks. Reporting in the newsroom this afternoon, I'm Darius Johnson.